I'm tired. I'm fed up. I can't stand it. I don't want to do this anymore. I'm burned out. Those are all words and phrases that I hear from patients on a daily basis when we start talking about COVID and the restrictions that have been put upon our lives and the things that we're having to do that are just out of the norm for us to try to prevent this horrible disease. But now is not the time to give up. Now is not the time to go back to pretend like we're not living through a pandemic or we don't have a highly contagious infectious disease running amok around us. I get it, we're all burned out. Healthcare workers, patients, everyone is burned out. But let me tell you why this is the worst possible time to be going through those burned out feelings and to be feeling like we're ready to give up. As we head into cold and flu season, as predicted, COVID cases are on the rise. They're not just on the rise a little bit, they're on the rise exponentially. Unfortunately, we knew this would happen. We were planning for the worst and hoping for the best, and unfortunately, the worst is upon us, or at least I hope it's the worst. Cases are on the rise, hospitals are filling up, and unfortunately, deaths will follow. Not because we don't know what we're doing, or at least don't know more of what we're doing than what we did 8 months ago when this started, but because if this continues at the rate that it is currently on, we will simply start to run out of space and run out of healthcare workers to take care of patients. We saw this back in the spring happen in New York City, and unfortunately, with the cases on the rise like they are, it's going to start to happen in more places around the country. And I don't say this to scare you. I don't say this to try to bring fear into your mind so that you submit to all of the recommendations. I simply bring this to your attention to try to hope that you will seriously consider the recommendations that are out there this fall and winter and heed them as best you can. Because it's not just patients, it's not just people that are burned out. Healthcare workers are getting burned out too. We've been at this for 8 months. People are working long, hard hours. They're tired themselves. They're tired of seeing people die in front of them of a disease that could be prevented with something as simple as a piece of cloth over your face. They're tired of seeing people die because people are pretending that this is a hoax and going about their normal lives like nothing is different. We can't continue to do that. We can't continue to flaunt the fact that this disease is serious and that it will continue to infect people whether we want it to or not. I'm not saying all this to try to scare you. There's enough people out there that will do that. I'm just merely trying to educate, trying to tell you the harsh realities of what we're dealing with. And I don't even work in the hospital. I work in the clinic, where thankfully we're a little bit more protected from this. I don't spend my day in a COVID unit, but I can assure you that I'm exposed to the virus on a regular basis. If you just look at the statistics of 3% asymptomatic spread, and right now in our community, 30% symptomatic positives. There are plenty of people out there that we come in contact with on a daily basis that could potentially infect us. But we go to work and we do our job every day, just like we always have, because that's what we're called to do. But today I'm asking you to do what you've been called to do, and that is to take some simple, realistic precautions to help you and your loved ones stay safe so that you don't become part of the statistics of how many people are getting sick, how many people are ended up in the hospital, and unfortunately how many people are dying. I'd much rather see you in the office for a wellness visit or a recheck on chronic conditions than see you in the hospital dealing with COVID. Yes, most people are going to get a mild disease and are going to recover without any problems. However, a good proportion of people are going to get sick enough to end up in the hospital. Or maybe you don't end up in the hospital. Maybe you have a mild to moderate illness and maybe you end up on oxygen at home for a couple of weeks, which I've been dealing with recently with a few patients. Or maybe you don't. Maybe you just have the mild illness. But unfortunately, I'm also seeing quite a few people who end up with lingering symptoms for weeks and weeks, begging me to do something about their cough or begging me to do something about the fatigue that they're experiencing so bad that they can't even go to work. And unfortunately, my answer is, I can't. I don't have any magic to fix you. Time is the only thing we have to treat this horrible disease. So why not take a few simple precautions this winter and do everything you can to stay safe? Yes, I know masks are not 100%, social distancing is not 100%, washing your hands is not 100%. There's no guarantee that you're not going to get sick no matter what you do. But anything that we can do to decrease our chances of getting sick should be done. Yeah, I get it. Face masks are not comfortable to wear. The face masks that most people wear in public are usually 2-ply masks that frankly are fairly easy to breathe through. I realize there are some people out there with respiratory illnesses who just simply can't, and that's okay. But for the majority of people, the overwhelming majority of people, there's no good reason that you can't wear a mask. There's no good reason that you can't stay socially distant. And roaming around the communities these last few weeks, I'm becoming increasingly disheartened by what I'm seeing. Seeing more and more people flaunting the virus and not wearing masks, not keeping their distance. And it breaks my heart to see that, because I know a proportion of those people are going to get sick. And some of them are going to call my office and want to be seen and want me to make them better when they're miserable with all the symptoms of COVID. And unfortunately, I'll be empathetic with them, but at the same time say, there's not much I can do. I can give you a few medicines to help with the cough, or you can take Tylenol or ibuprofen to help with the aches, pains, and fevers, but nothing's going to fix it but time. There's no magic bullet out there yet. There is hope. There's 2 promising vaccines on the horizon, but in reality, we're going to be dealing with this probably till next summer, because it's going to take that long once a vaccine is approved to get enough of it made, distributed, and get enough people vaccinated to start to get this virus under control. The only thing we can do in the meantime is what you've been told for the last 8 months to start doing. Wash your hands, wear a mask, and keep your distance. That is all we can do right now. Now you've got some tough choices to make as we head into the holidays. Next week is Thanksgiving. Are you going to go visit grandma? Are you going to travel? Are you going to take a vacation? Those are all decisions that you have to make. No healthcare worker can make them for you. But I hope you'll at least heed the warnings of the experts that are out there. Again, they're not giving you their advice to scare you. They're not giving you their advice to control you, just like I'm not making this video to do any of that. We're simply trying to inform you and help you make good decisions. My recommendation would be perhaps to skip grandma's house this year. Give her a call instead of going over for dinner, because you don't know what you're bringing besides the side dish. You may be bringing COVID to her, and you may do fine with it, but grandma might not. Our own family has decided to stay home this year. And trust me, I was really looking forward to going and getting some pie from my mother-in-law's house. She makes a mean pecan pie and a really good chocolate pie. And I was really looking forward to eating some of that pie this year. But that's not going to happen, because we know that with my job and my kids going to school, that we could potentially be infected any day, be asymptomatic, bring the virus to their house, and unfortunately infect them, and they're in a demographic that may not do as well with the virus as perhaps younger folks would. So we're going to make the tough choice to stay home. Probably we'll do the same thing at Christmas, not because we want to, because we want to do what's best for our family members. And I hope this year you'll consider doing the same thing. This is serious, guys. This isn't a hoax. This isn't a joke. This isn't something that went away with the election. Isn't something that's going to magically go away when the new administration gets sworn in. We're going to be living with this for another several months. So why not do the right thing now? Protect yourself, protect others, take simple precautions. A mask is not a political statement. A mask is a simple way of protecting yourself and protecting others. Staying out of crowds, staying out of indoor spaces this winter. It's going to be really tempting to want to go hang out with your buddies and watch a football game, or go hang out with the ladies and have a ladies' night. That's probably not recommended this year. Unless you're masked and staying 6 feet apart at all times, you're putting yourself and your family at risk in doing so. And I know that sounds harsh. Heck, I'd love to have the guys over and watch football this year. We did it several times last year and it was a great time. But Guess what? I haven't had a single football party this year and probably won't, because I want to do the right thing for myself, my family, and my friends. I implore you to do the same thing. Think about every activity that you're doing and whether it's going to increase your risk of developing COVID or not. Unfortunately, that's the way we have to think this fall. We have to look at everything we're going to do every time we step out of the four walls of our house and decide, is that activity going to increase my risks? Is it something that I really need to do? Is it something that I can put off? Is there something I can do differently about it to lower my chance of contracting COVID while I do it? There are things we have to do. I have to go to work every day. My kids have to go to school. They need to get an education. But we're going to take all the necessary precautions in those activities that we have to do in order to minimize the risk. And then as we think about activities that we might want to do, we're going to assess the risk every time we go out the door and decide whether it's something we should really do or not. And in many times, we're not going to do it. And that's not going to be fun. It's not going to be enjoyable. My kids are going to complain all winter long, I can assure you. But I'm going to do my best to explain to them why they can't go over to their friend's house, or why they can't go have dinner with their friends at a restaurant, or why they can't go hang out over at a friend's house. Those are just the harsh realities of what we're dealing with. The sooner we all take this virus seriously and take all the simple public health precautions that you've heard over and over and over again since this pandemic began, the sooner we get out of it and the sooner we get to go back to normal lives. I'm ready for a vacation. I don't know about you guys, but I'm ready to hit the beach. But I'm not going to do that until this pandemic is over. Because unfortunately, I don't feel like it's safe to travel to those vacation destinations right now. And two, as a healthcare worker, I feel like I need to be here for my patients and take care of them when they get sick. So I'm hopeful we can all do the right thing, get to the end of this pandemic sooner rather than later, and let's all go take a vacation. All right, sorry this video was a bit preachy. I've been contemplating making it or not making it for a couple of weeks now, but with cases going up and all that's happening around us, I felt like it was time to just put it out there and plead with you to do the right thing, take all the necessary precautions to keep yourself safe, keep those around you safe, so that we can all get to the end of this, get past the burnout, and get back to normal life as soon as we can. All right, you may not have enjoyed this video as much as some of the other ones I've made, but I hope it was at least informative and at least explained why you're seeing healthcare workers plead with you to do the right thing. I hope you have a good and safe holidays, whatever you decide to do. Remember, be safe out there.